Good afternoon and welcome to another edition of Chill with Bill, San Antonio Zoo, San Antonio, Texas. And today I have the pleasure of meeting Dr. Tim McAvoy. He is a pediatric ENT, an ear, nose, and throat doctor. So how are you today, sir?
I'm good. How are you?
I'm well. And today we're at the black howler monkey habitat at San Antonio Zoo. Did you know that howler monkeys actually have respiratory issues?
I didn't know that, but I do see a lot of monkey stuffed animals in the clinic.
Dr. McAvoy, what kind of issues do you see with kiddos related to your practice?
One of the main things we see related to kids is breathing issues, especially in young babies. That can frequently be noisy breathing, which could be really squeaky noises like or snoring type noises. And a lot of times we want to sort out why is that noise happening. And that's something that we do both in the clinic and sometimes in the hospital, depending on how sick the child might be.
What type of equipment do you use when you're taking care of pediatric patients?
A lot of times we use small versions of the same things for adults. And so we have small little cameras that can go in through the nose. We also have other small cameras we can use in the operating room to look at the larynx or voice box and into the trachea. We can also use some of the same instruments to help do surgery to help when kids have either floppy airways or other things blocking their breathing.
Wow. So I remember as a child, my sister put a grape up her nose. Is that something you see very often?
We do see that. We see all sorts of things in the nose, all sorts of things in the ears. And so those are definitely things that we can help to get out, either on an emergency basis or semi-urgent basis through the clinic.
Did you hear that noise?
I didn't hear it.
It was very loud. I can't believe you didn't hear it.
I should probably go see my audiologist tomorrow and see if they can check my hearing. That's also part of our full spectrum ENT care that we have available with our team. Our audiologist is great at testing children of all ages and all developmental statuses because sometimes testing kids is a lot harder than testing one of us.
Dr. McAvoy, do you see any seasonal type issues with kids?
So we definitely see a lot of things that are seasonal, especially related to cold and flu season, which we're coming into right now. A lot of times that's related to just lots and lots of mucus, lots of boogers. Sometimes we can manage that all at home just using saltwater spray and suction. But some of those things get worse, and that's where you want to bring your child in to be evaluated with our full team of pediatric specialists to make sure there isn't anything else going on or other things we would need to help fix.
What do you do for kids that maybe need imaging and maybe they're a little afraid to have that imaging and can't hold still?
So for that, we work with our radiology department, which is really good at dealing with kids. And they can kind of work on distracting them and trying to get the best pictures. Sometimes even distraction isn't enough, and we have to use our sedation team, which is awesome to help kids to calmly get through an imaging study so we can figure out what we do next for their care.
Do you think howler monkeys have a special set of vocal cords since they can yell and be heard at very long distances?
I mean, they must. And so at some point, I would love to be able to put my little camera in their noses, but I'm sure that might be harder to convince the zookeepers to let us do.
For sure. From San Antonio Zoo, Dr. McAvoy, thank you for coming out and hanging out with the howler monkeys.
Hey, thanks for having me out. I appreciate it.